thank you all for joining us this beautiful afternoon. It's sunny outside. To learn more about pregnant and lactating people and the COVID-19 vaccine. So thank you all. I appreciate you being here. Um, the first thing that we get in questions is about the COVID-19 variants. Recently, we just had a huge surge of Omicron, a variant of COVID-19 in December and January. So we'd like to kick off this presentation speaking about the COVID-19 variants, more specifically Omicron. Like all living organisms, their main purpose is to survive, and the way viruses survive is by mutating. The more mutating and becoming resistant to vaccines. So that's the purpose. All viruses mutate and evolve, and it is still COVID. What is different is the way it how strong they are. So, for example, for Omicron, and it's still COVID, but what we know is that it's more contagious than previous COVID-19 variants like Delta. So what we know about Omicron, like I said, it's still COVID-19, but the only difference is that it spreads more easily than previous variants, including Alpha and Delta. In general, it's the same. It's just, like I said, it spreads faster. We've seen that it causes less severe illness compared to other variants, but there are still individuals that become very ill and might end up in the hospital or even dying as a result of having Omicron. But what we know is that we can still fight Omicron the same way we fight COVID-19, Delta, Alpha, and all other variants. We can still prevent it from spreading by wearing high quality masks that they're well fitted, that make sure they cover our nose, our mouth, and that we can improve indoor air quality through ventilation and avoiding crowded indoor spaces, making sure that we keep each other physically distanced and getting tested, and staying home if we are starting to show signs or symptoms. More importantly, if you are feeling sick and have tested positive for COVID, to make sure that you're quarantined, and lastly, make sure that you're vaccinated and have your booster in place. So what we know about Omicron and vaccines, we know that they're very effective in fighting Omicron, and it's the best thing that we can do to protect ourselves against COVID-19. And the more people that are vaccinated, the more protected we will be. We'll stop the COVID-19 for keeping mutating into other variants. The more people it touches, the more it mutates. So if we stop that spread by being vaccinated and getting booster, we stop the virus from mutating into other variants. And still, people that are unvaccinated remain at the highest risk, both from Delta and Omicron. Yes. So how do, in general, vaccines work? For vaccines, they help our body develop immunity to the virus that causes COVID-19 without getting sick with COVID-19. Once our body receives the vaccine, our immune system starts to produce antibodies that fight the virus, which protect us in case we are exposed to COVID-19. So our body already knows how to fight COVID-19 in case we get exposed to it. It creates antibodies. And the most important thing is what we get is vaccines. Their goal and main purpose is to prevent severe illness, hospitalization, and death. So I know there's a lot of breakthrough cases, but with vaccines, but usually people do not end up hospitalized or even have death from COVID-19. So that's the main purpose of vaccines, to prevent severe illness, hospitalization, and death from COVID-19. So right now, here in the United States, the Food Administration has approved 3 vaccines, which is Moderna, Pfizer, and Johnson & Johnson, which have proved to be safe and extremely effective against, like I said, severe illness, hospitalization, and death. Moderna and Pfizer use the same technology, which is the mRNA, while Johnson & Johnson use a different technology. Here, I'll just put sort of a diagram of each vaccine. Pfizer and Moderna is a 2-dose series as opposed to Johnson & Johnson, which is one dose vaccine. And Moderna and Pfizer have been approved to folks after they have received their 2nd dose after 5 months, and Johnson is 2 months after receiving that 1st dose. Right now, the only one that's approved for folks 5 years and older is Pfizer, but Johnson & Johnson and Moderna is for folks 18 years and older. And what to expect after getting vaccinated? Possible side effects is to have a sore arm, fatigue, headache, and mild fever. These usually last from 1 to 2 days after getting your vaccine. They ask you to spend about 15 minutes in case you have any allergic reaction to the vaccine, and making sure that you monitor during those 15, 30 minutes and making sure there's no severe allergic reaction. And so these are the most common questions that we get and we've been doing this almost for 1.5 years now, and these are usually the questions that we frequently get. And one of them is, will the COVID-19 vaccine make me sick or give me COVID? And the answer is no. The vaccine doesn't have the virus in it. It's not the live COVID-19 virus that you'll be getting, and it cannot cause COVID-19 infection. Like I said, the vaccine doesn't have any COVID-19 virus in it. And I know we have different questions, but we still get this one. What's not in the vaccine? There's no microchip in the vaccine. And people then ask us, well, how do we know? It's not just Moderna, Pfizer, and Johnson & Johnson telling us. There's multiple independent bodies that have done rigorous research during the vaccine production and after the vaccine production. A lot of independent bodies, including Seattle Children's here, have done a lot of research and have done independent studies to make sure that the standards and qualities of the vaccines are meeting every standard. There's no fetal tissue in the vaccine. There's no animal product, pork or byproducts or eggs. The vaccine is completely synthetic. So if you're worried about any religious concerns or any dietary concerns, it does not have any animal byproducts. And does it have any toxic metal or potentially toxic ingredients? No. We've heard a lot that does the vaccine make us magnetic? No, it doesn't. It's, like I said, purely synthetics. The ingredients are very, the mRNA, the buffers, the salts, and the sugars to make sure that our bodies don't reject the vaccine. But if we compare like any type of bag of chips to the ingredients of the vaccine, the bag of chips will have way more ingredients that the vaccine does. So the topic of our audience today, can pregnant women or lactating people get the vaccine? And the answer is yes, and is highly recommended. And Giselle will go further into details why specifically pregnant women should get vaccinated, or pregnant people should get vaccinated. And also, if you can get vaccinated and if you already had COVID, can you get vaccinated? And the answer is yes. We don't, immunity after naturally occurring infection of COVID-19 doesn't last long. So we recommend as soon as you feel better and are out of your quarantine period, get vaccinated for those that have already tested positive for COVID-19. Like I said, will the COVID vaccine maybe make me magnetic? No. Um, I have my vaccine, and I'm also a booster, and I can tell for sure I'm not magnetic to anything. Will the COVID-19 vaccine affect my cycle or menstrual periods? So some people have reported temporary changes, but the vaccine does not affect fertility or nor the ability to get pregnant. Our period can change a lot for many reasons. Stress, change of work, change of routines, things can change. But I think what people get at this is, would that affect my fertility or ability to get pregnant? And the answer is no. The vaccine doesn't get into the nucleus of our cells to be able to impact that. Next, and so what slides are we? So here's a few things that you should know in terms of getting to COVID-19 and pregnancy. So when we get pregnant or people get pregnant, there's a lot of changes in our body, of course, and pregnancy causes changes in our body that could make it easier to get very sick from respiratory viruses like the one that causes COVID-19. And these changes can continue after pregnancy. And we know the term long-term COVID can be very I feel like a lot of people say, if I get COVID, I'm young and can get better. But then there's also the risk of long-term COVID, that symptoms that our body will suffer long after being positive with COVID. And pregnant people have an increased risk from severe illness from COVID-19 when compared to non-pregnant people. There's certain underlying medical conditions and other factors that, including age, that can further increase a pregnant person or recently pregnant person at risk for developing COVID-19 illness for 42 or more days following end of pregnancies. So pregnant people are at more serious risk of COVID-19 and having long-term COVID, like I said, 42 days or more following the end of pregnancy. And like I said, and also there's pregnant people with COVID-19 are at increased risk for delivering their baby earlier than the 37 weeks and might be at increased risk for other poor pregnancy outcomes. Compared to people who are not pregnant with COVID and have symptoms, people who are pregnant with COVID and symptoms are more than twice as likely to need treatment in an ICU, a ventilator, or life support, and are 70% more likely to have illness ending in death. So those are a few things of how pregnant people are at most severe risk than people who are not pregnant. You can deliver your baby earlier than 37 weeks. You are likely to be on an ICU bed, ventilator, or life support, and are 70% more likely that illness will end up in death. Is there any question? Please feel free to jump in at any moment. So given those facts, it is especially important for pregnant people and recently pregnant people and those who live with or visit them to protect themselves from getting sick with COVID-19. Like I said, pregnant people are at most risk of suffering severe illness from COVID. So my last slide before moving on to my colleague, Giselle. COVID-19 vaccination is recommended for all people who are pregnant, recently pregnant, lactating, trying to get pregnant now, or might become pregnant in the future. The benefits of getting the COVID-19 for pregnant people outweighs any known potential risk. Life has many risks, so we have to measure them. And when it comes to pregnant people and vaccine, the benefits far outweighs the potential risk. With that, I will pass it on to my colleague, Giselle. Thank you, everybody.
Thank you, Gina. Okay, let me go ahead and get it back on the screen. There we go. So now we're going to talk a little bit about boosters. As Gina mentioned, the importance of getting vaccinated for pregnant women, as well as if you are breastfeeding or nursing. The first step is the vaccine, but we do have to also follow up with the boosters. We are finding that it is important to make sure to get it in the time frame that it is recommended, because the protection that you receive from the initial doses do decrease over time. And basically the booster shot, quote unquote, boosts your immunity. So that way you can maximize the protection. Keeping in mind that this isn't unique to just the COVID-19 vaccine. There are other vaccines that also have either a series or boosters. So this is not uncommon in the vaccine technology. So keeping in mind, boosters are just as safe, and they continue to be recommended for pregnant individuals if they're lactating, nursing, or who are interested in becoming pregnant very soon. So we highly recommend that if they are choosing to get vaccinated, that they also follow through with their boosters as well. So anybody over the age of 16 is now eligible to get their booster. Keeping in mind that Pfizer or Moderna, and actually this recently just changed down to 5 months instead of 6 months. I apologize, I didn't catch that on when I was updating the slides. But regardless, there are some clinic systems that are still, they haven't updated their, it happened because I personally had this occur, but some clinic systems haven't updated yet, but technically folks are being recommended to go on 5 months to get their booster. So that would be for Pfizer or Moderna. And then Johnson & Johnson would be recommended 2 months after the one-time dose that they got. Although there is with Johnson & Johnson, there is a very small risk of blood clots. So in women in a certain age group. So if you are considering Johnson & Johnson, please double check with your provider if that would be the vaccine that you want to continue receiving the booster in, because even if you got Johnson & Johnson the first time, you can switch it over to Pfizer or Moderna for your booster. So one important thing to note. And then those who are 16 and 17 are only authorized for the Pfizer vaccine. Very important. Anybody under 18, the only option they have is Pfizer. They have no other options. But when it comes to boosters, we now know that the only group that's authorized to get that booster is anybody 16 and up. So if you do have any further concerns or you want to explore a little bit more about the COVID vaccine or the boosters, of course, check if you do have a provider, check with your provider. But we also do have information on our website, the kingcounty.gov/vaccine, where you can also locate options of where to get your vaccination. So for individuals who actually do get ill and catch COVID-19 and are in the midst of nursing, either breast or chest feeding, what has been found at this point is that it is unlikely that COVID-19 can pass through the breast milk and get the baby sick. So important thing to know, because that's been a really common question. At this point, what all the researchers and scientists and doctors, medical professionals are finding is that it is safe to continue to breastfeed or chest feed your baby, even when you have COVID-19. Breast milk, of course, continues to be the very best source of nutrition for most babies. That has been, without a doubt, for centuries, I would say, but especially in the last century, where they have found that breast milk simply, if you have that option, it is the best nutrition for babies, especially because it helps protect them from infections, and that could be infections of the ears, lungs, or digestive system. But in general, if you do get COVID-19 and you're able to continue to nurse or even pump, the breast milk is going to be the best option for your little one. So ideally, we recommend to continue to breast or nurse your child. And of course, if you are sick and you are breastfeeding, it's always good to just check in with your doctor or provider if you have one. So that's worthwhile. And I think it just depends on how ill the individual is in terms of their symptoms. Now, how can you avoid passing COVID-19 to the baby? Some of the very pretty, common ways to do that. Of course, continue to use your face mask or covering when you're holding the baby. And that, of course, includes when you are nursing. Definitely not putting a mask or covering the baby's face at all. That's definitely a risky thing to do. Always making sure to wash your hands before you touch the baby with soap and water. And then also washing your hands when you're going to touch any parts of the breast pump or the bottles, when you're cleaning the pump and the bottle parts after every time that you use them. Of course, make sure you want to wash your hands with soap and water every time so that you have no germs on your hands. Now, if you do have somebody with you that can help take care of the baby who's not sick, that's always a good thing. That can be helpful and supportive to you if you're sick yourself. The individual can help with bottle feeding the breast milk that you have expressed after you've completed the pumping. That individual should also still wear a mask, and also please keep their hands clean after washing with soap and water. And ideally that they shouldn't be at risk of a severe illness from COVID-19. Some people are immunocompromised, so we want to make sure that folks are just aware of that as well. Some of the things, and Gina shed some light on this, definitely COVID vaccines will not cause infertility. And that's known as when a person can't get pregnant or get somebody else pregnant. The COVID vaccines do not make it harder to get pregnant or for somebody else to get them pregnant. So it is something that has been a concern, and there's been some, misinformation floating around, and it has not been found to affect infertility or fertility at all, nor to reduce sperm count, nor increase the risk of miscarriages during pregnancy. And the COVID vaccines will not give anybody COVID-19, and that includes people who are pregnant or their babies. I think that's important to note. The COVID vaccines don't have a coronavirus that's live to give you coronavirus. So I think that is a real misunderstanding that is out there. And I'm hoping that that's changing, but that's possible, simply not possible. So keeping in mind that when you are vaccinated, it's antibodies that are shared while you're pregnant and through nursing. That's actually a good thing, right? Because that means that the vaccine that you're receiving protects the person who's pregnant, and it also protects the baby while you're pregnant and while you're nursing against COVID-19. So that's actually a really good thing for individuals to take into consideration, because in that way, they're helping protect themselves and their little one. So we're going to go over a few resources real quick. And I did want to make sure there haven't been any questions in the chat. Okay, good. All right. So we've got some information here that we're sharing. It's the mothertobaby.org /ask an expert. It is a service provided by a different group. We welcome you to check out their page. Also their phone numbers here on the screen, the 1-866-626-6847. It's called Mother to Baby. And they do provide free and confidential services in English and Spanish, Monday through Friday, 8 a.m. to 5 p.m. So they've got some experts that can also answer any questions that may come up in the future. There's also a frequently asked questions for pregnant women about COVID and the COVID vaccine, and they have a lot of information on there. So please feel free to visit and kind of explore the website, take a look at what else they have in there. Lots of good information that's kept up to date. And then a resource that we have here in Washington State, it's based out of King County. It's called Community Health Access Program, better known as CHAP. And CHAP actually originally started as a health access program to help those who need help with getting free or low cost health insurance, or say some of these programs that provide free services, such as the breast, cervical, and colon health program. And they've expanded over time to add ORCA Lift cards, access to baby and child dentistry, basic food, childcare, and utility assistance programs through DSHS. So they are in existence to answer questions around health access, to provide support in checking for eligibility, whether folks are eligible for any of these programs, whether it's they just need to find a federally qualified health center, or they have their Molina Apple Health card, but they don't know who their provider is. And so the CHAP staff are able to answer those questions, assist them with the application process if they are eligible, and basically help them kind of navigate the system and understand how to tap into the resources. So it's a great service. There's staff that speak several different languages. And if not, then we have the language line interpreters that can be used. But it's a great service to be familiar with. Again, the 1-800 number 756-5437 is an easy call away, but you're, oh, and I just realized, Gina, that I didn't change out the link I put the Spanish link on this slide. Sorry about that. If you can switch it to the English for the chat box, that would be great. And so we have that page in both English and Spanish, but we welcome you to familiarize yourself with it, and please feel free to send clients. All the assistance is done over the phone. And then we do want to encourage folks that if they are finding that they've got either symptoms that they're concerned about, or maybe they've been exposed, there are continue to be testing sites that you can go to for free that are either run by public health or some of the partners. The link here is on the page that you can visit to see the most up-to-date list of the testing sites. But if not, you're welcome to call our 206-477-3977 number for the location of the nearest one for you. Or if you need an interpreter, they're more than happy to get an interpreter on the line to assist you with that. And again, this is a service that is provided by King County, but the actual testing sites can be a variety of different partners, either public health themselves or groups such as UW Medicine or City of Seattle or that kind of thing. So please feel free to explore that website. And then our wonderful pages, one on COVID-19 vaccine, which includes the community vaccination resources. But from there, you can also navigate over to just in general COVID-19 information in different languages, as well as the things such as the current mandate that will be ending on March 1st. There's lots of really great information. So we invite you to check out our website, which is that kingcounty.gov/COVID. And I think I'm going to go ahead and stop. There we go. Perfect. All right. Thank you, Gina, for getting all that in the chat. So are there any questions that come to mind?
I have a quick question.
Yeah.
So I'm not quite sure. I did not read any research on this, but I heard that the color of the breast milk changes after getting COVID vaccine. Is this a myth? And could you just talk about that, like about the quality of the breast milk, or like how, if it has got anything to do with the breast milk color or something?
I have not come across that at all, Ruchi, and I apologize that maybe it's something really new. I don't know if Gina, have you come across that yet?
No, not at all. It's first time hearing about it. Oh,
But we can look into it and check with Becky and see if she's got something more up to date. You know, that's the funny thing I got to say, Ruchi, about this whole, from the very beginning of the pandemic, it's like things start one way and then it's like changes and then we have to go back. And that's why we have to update these presentations every time, because something could change overnight. And it's not quite as easy as other things that we present or train on. But it's good because it definitely allows us to make sure we have the most up-to-date information. So if you don't mind, we can do some follow-up on that and get back to you. Sound good?
Yeah, sure, no problem. Yes, yes. So this is something that I heard from one of my like PEPS class friend, and I wasn't sure. It did not change color of my breast milk after vaccination, but since we were having this talk, I thought this is an appropriate question to ask.
Yeah, no, it is a good question. I definitely haven't heard it, but doesn't mean it's not happening, and it doesn't mean that that there's, because I mean, you know, honestly, sometimes there are things that that are shared from either the CDC or from, you know, the Department of Health, for example, and then the symptom or the cases, they start increasing. And that's when they start realizing, okay, well, there may be some aspect of this. It's a very small percentage of group of people that this happens to, but it could, but you know, but it's still safe. Or in the case of, honestly, the Johnson & Johnson vaccine, where they, you know, I mean, they really felt after all the trials, everything was safe. And for the most part, it was, but there's a small percentage of people that it could be, you know, kind of scary for. So that's when the recommendation changed to, you know, women in a certain age group, maybe, you know, you might want to reconsider the Johnson & Johnson.
Yeah, no,
Things
I
like that.
appreciate. Yeah, I appreciate. Thank you so much. Does anybody have any other question? No question? I have another one. Did you hear anything about vaccination for children as young as 1 or 2 year old? Because there was some news coming out saying that they would be starting, like, you know, making the vaccinations available for infants and toddlers. And then there was a news that FDA wanted it to be halted for some time. So do you have more information on that?
What we have at this point, and feel free to chime in, Gina, is that it's definitely not happening quite yet.
Okay.
Yeah. So we thought for a little bit that it was around the corner, and then all of a sudden they said, nope, we need to do some more trials. So I'm not sure, Gina, if you heard an estimation, if it's end of the year or next year, but didn't sound really close by.
no, we were hoping, I think 2 weeks ago, for it to be released, but they didn't get the dose quite right. Children have a really good immune system, and they had questions regarding the dose, if it was the right dose, and if it was effective. So they went back and just have to wait and see, but we don't have a date yet.
Thank you.
Ruchi, since we're going to see you next month, we might have an update next month. We'll have to see.
Yes.
Keep you posted.
After I asked the question, I was like, probably this is for the next month.
Maybe, we'll see. Hopefully they got updates next month. Yeah.
Okay, that's great. Any other questions? Maria, do you have any specific questions?
No, thank you. I think everything is clear. Thank you so much.
Oh, you're welcome. Good. Are any of you hearing concerns right now with pregnant women or breastfeeding? Yeah. Very quiet bunch.
I'm gonna say I heard kind of what Rushi asked about the breast milk changing, but I heard that it wasn't with the vaccine. I heard it was if you got COVID, then your breast milk changes to almost like a colostrum color.
Oh, interesting.
But that's it.
We'll definitely look into that because, yeah, this was our first time hearing about it. So thank you. Thanks for sharing that. So we'll bring that back to you, Ruchi, once we get a more definitive information.
Sure.
Yeah.
Sure. I think
And I
Lena
do.
raised her hand. Yeah, Darcy,
Oh.
sorry. Go ahead.
No, I was gonna say I didn't know you could raise your hand. Sorry, I'm still learning Zoom. I just had a quick question. So when you guys said that the infant and toddlers, was that the rumor that was going around that like in spring 2 and up would get vaccinated, and that's no longer happening as of now? Okay, thank you.
Correct. It will eventually. It's just not as close by as we thought it was going to be.
Yeah, I have an almost 2-year-old, so I was like, ooh, fingers crossed, but we're not there. That's okay.
Oh.
Thank you, Darcy. Lena?
Yeah, so there's no concerns about that, but there's a pregnant woman who got her first shot, actually the J&J, like it has been a while, like 8 months now, and she is only 2 months pregnant, and she was asking if she can get her booster shot, and if so, then which one should she get, like Moderna or Pfizer? So that was somehow like tricky as far as it was J&J, the first dose, and also it has been like almost 8 months. And so if you guys can just like advise on that, or if you guys know anything about that so that I can just like pass it on to her. Thank you.
Thank you, Lena. That's a great question. As we mentioned, the booster after a J&J vaccine should be done 2 months after they get the J&J. So she's definitely way overdue, and would be eligible for either Pfizer or Moderna. We're not allowed to recommend one or the other besides what I've shared. But I will tell you that we had a doctor on one of our weekly calls, Dr. Perez, who made me laugh because he said, he actually did say, I recommend Pfizer. And the reality is both Pfizer and Moderna are safe and effective. But I have seen some people, even a physician, who recommended Pfizer over Moderna. But it's really a personal choice. And I think part of it is doing your homework and taking a look at some of the information that's out there available from a trusted source like the CDC or the Washington State Department of Health or Public Health Seattle and King County, and doing a little comparison. But honestly, it's very minimal difference in terms of effectiveness. Gina, wasn't it like 94 versus 95% effectiveness, something like that? So
Yes. Yeah.
yeah. I don't know if you wanted to add anything about that, Gina.
No. She's past overdue. I would highly recommend for her or for them to get their booster as soon as possible. Like we mentioned, pregnant people are at most risk of severe illness due to COVID-19. So would highly recommend getting booster.
Either one of them. Yeah, just probably not Johnson & Johnson.
Yeah, maybe, yeah. Probably Moderna or Pfizer. Mm-hmm.
Okay, thank you.
You're welcome. It's interesting because I think one of the things we have to keep in mind, having had 5 pregnancies myself, that, our bodies are doing everything it can while it's pregnant to help the baby grow, to be healthy, and to have, a full-term pregnancy, right? And so when our bodies are working so hard to do that, I think it's important for us to do things that are protecting us as well, and in turn can protect the baby. So I think that's something that we have to keep in mind, and that no vaccine is going to have no side effects. You're going to have some possibility of not feeling a little sick or under the weather. So don't let that hold you back. I think that's part of, our body telling us, okay, it's working on creating those antibodies to protect me and my little one. And so I think it's really important that it's not just the initial vaccines, but also the boosters, because it has been found at this point. I mean, and honestly, you guys, there was a period of time when Gina and I could say, there's not enough information. We can tell you what, they believe is going to be the case. But now we can say for sure at this point that everybody's going to need a booster. And that's not a question mark at this point. They have found with certainty that the vaccines do lose its effectiveness over time. So those boosters are crucial. So the question at this point that I see is more like, okay, well, how many boosters will we need? Because, honestly, when you look at other vaccines, like the flu shot is every single year, right? Because those variants change. But tetanus is every 10 years. And that's not necessarily apples to apples, but it's like when you think of vaccines, you've got all of these different series depending on which vaccine, because of their effectiveness, because of how long they last. I mean, little children get the DTaP and the MMR and the chickenpox, varicella, and I mean, I think oh my gosh, this latest one that I know I had to take my daughter in, and they were saying, oh, she should really get it before a certain age, because once that age has passed, then you have to get 2 doses instead of 1 or something like that. And so it's going to vary from vaccine to vaccine. And I think that's where we're at with the COVID-19 vaccine, is that they're still trying to figure out exactly how many boosters we'll need, if this is for your lifetime, or if after a certain amount of boosters, you're good to go for, 10 years at a time or something. So I think that's the part that we're still trying to figure out, and time will tell through the trials as well as through the people that are getting vaccinated. But I do think that there should be no doubt in getting the booster, that for right now, definitely. Absolutely. So thank you for that question. Anything else come to mind?
Okay, I think you have answered all our questions, and it was really informative topic. And I really appreciate you touching on each and every aspect of this crucial part of the lifespan. And as always, we are really, really appreciative and thankful for having you, Giselle, and Gina to address our audience today. So thank you so much.